Much, Mr. Azizi. Again, to follow up on Mr. Mahmoudzade's point, it's really important that governments take a decisive position, as the Tajik government has, pledged to bring back all of their citizens. So now we're going to move on to the question and answer session. As we said before, these questions are asked by our participants in the Zoom chat. Our first question is for Ms. Marshall. Ms. Marshall, your presentation was really powerful and really conveyed a story that was really difficult. Many people going through very difficult experiences. The inevitable question is why? Why are they still in this situation? Why aren't countries stepping up and repatriating? Is Save the Children involved in advocating or cooperating or talking to governments about this issue? And if so, what is their reluctance? What's the holdup here?
Thank you for that question. And I think there are, of course, a couple different parts to that. So as you know, we've recognized the conditions and what they've experienced are extremely dire. And as you know, Save the Children is a globally recognized organization with members around the world. And so we do a significant amount of advocacy work. And this really runs the gamut from private influencing others to speak out, to campaigning and media work, sometimes directly in capitals. We meet with policymakers, we provide information about the conditions as we're doing today, and we speak out in the media to exert pressure. And really, we also try to campaign where possible with families in capitals to provide support on specific cases to their efforts on repatriation. And then we participate also in policy dialogue. So we have a very kind of multi-pronged advocacy approach that is necessary. And I think, the question of why is this not happening, our expert colleagues illuminated what some of those challenges are. And so there are real and kind of perceived risks, and when the lens that's taken is a securitized lens, and I think it kind of narrows the conversation in a way that limits an appropriate framing, which is really should be around the best interest of the child. And also, frankly, a recognition that these are individuals and individual cases. And so that we can take also an individual look at some of these situations and recognizing also the limitations inside Syria after a decade of conflict. To remain in Syria does not bring us any closer to safety or a solution for these children. So that the point is really to advocate for repatriation and the support and processes, as our colleagues have explained, not without challenges, but with kind of proven experience and what we know can be done, and that the positives and the ultimate kind of outcomes for children so much outweigh, the complex challenges that we can and will navigate through. So I think it's also important to see best practices from countries showing how this can be done and looking at those different channels of pressure, and countries are doing it, and that is important. Even with COVID-19, we have seen recent repatriations take place from a number of countries, including Uzbekistan, as mentioned, Germany, Finland, Canada, Russia. And so when governments want to do this, it is possible, and we, along with our colleagues in UNICEF and others, are standing ready to support this and want it to be that priority that it should be in the interests of these children. Thanks. Would welcome also perspectives from my colleagues on what some of those barriers are and how they might see, advocacy being effective.
Yeah, thank you, Ms. Marshall. That's a really illuminating question. And again, we're talking about countries, Germany, Finland, that have the resources and the capacity to actually make this happen. And so my next question would be for Mr. Mahmoudzadeh, and it's a similar one. And so Uzbekistan, a country with admittedly less resources, is capable of making this repatriation happen, bringing back many of their citizens. How involved is UNICEF in that process? Does the UNICEF team solely provide coordination, perhaps help to bring children back through the flights, or is there specific logistical support that is necessary and that helps Uzbekistan overcome the barriers, as Ms. Marshall mentioned, the barriers to repatriation?
Mm-hmm. Thank you for the question. Also to again complement what Angela was referring to, I think what is key here is the political will. I don't personally think it is matter of resources. What we have witnessed clearly in the case of Uzbekistan was the strong political will and kind of rigorous follow-up. Because also in some cases we see some signs or demonstration of political will, but then it is not always translated into something practical and meaningful. So when it comes to UNICEF's engagement, there are different levels of work that we are undertaking. One is that we are present in Syria as well. We have country office there. So we have our implementing partners and partner organizations with whom we regularly exchange information and data. So what we were doing at the level of the country office, we're regularly sharing all the available data to us about number of women and children in Iraq, of course, and then Syria. And then we also supported the role of the ambassador, as it was the case in Tajikistan, to stay in touch with UNICEF country offices in Iraq and also identify cases of Uzbek citizens, because identification process is one of the processes that countries are usually concerned about. So they want to be sure that it is their citizens or children are born by their citizens. So this is something that really concerns them, and they approach UNICEF for technical assistance in that area. But what is important, we haven't been engaged in physical repatriation as such, so we didn't cover the cost of the repatriation, charter flight or whatever. But what is very important, because again, our experience that when there is a political will and practical measures taken, repatriation might be even the easiest part of the story, right? Once they arrive to the country, then the entire story begins. And this is where we were extending actually our technical support. So family tracing before actual repatriation. So we got the list of children and women. We managed to provide technical assistance to trace extended family members. So we prepared social workers and psychologists to travel to talk to the family members, etc. What we need to understand also is that in Central Asia or most of the post-Soviet countries, we still don't have established social work system. So we usually lack professional social workers or psychologists, and therefore filling that gap through bringing on board technical experts or civil society partners was key. And this is what we were supporting government with. But also, as I mentioned earlier, all the coordination process, because the integration part is more kind of also multi-sectoral issue that needs to be looked at. So we need to bring health-related authorities, education, social protection, child protection authorities all together to make sure that we have the comprehensive approach to the reintegration process. So Interagency group was established and UNICEF was part of it. So we were guiding them throughout the process. We were making clear what are the key principles that I was mentioning about, because again, initially, perhaps thinking was that maybe family tracing is not that key, but after explaining the importance of reintegrating children and women into communities, there was a full support from the government, and this is how the process was successful. But what is key to that also, I think, in the communities where families and children were reintegrated, the importance was not to create an environment where they will face additional stigma or discrimination. Because sometimes in some contexts, with again goodwill, we try to create additional, sometimes provide additional support and overdo certain things, which might create some issues with the receiving communities when there are some deprivations anyway or challenges that other children are facing, and child protection systems are not always there to address their problems, right? So making this group more privileged than others is also another way of stigmatizing them, and this is something that we paid particular attention. So capacity of the service providers in advance of the repatriation, and actually during reintegration process, and also monitoring of the cases. So since 2019, although we had all these cases, so it's already the third year, and there were 3 campaigns, we're still helping government to monitor all the cases. And as my colleague from Save the Children mentioned, individual approach to the case management is key here. So we're making sure that families are somehow regularly followed up. And then in addition to monitoring, we were trying actually and extending our support and more at the level of service provision during the pandemic, because in COVID-19 times, certain groups are more vulnerable than others, and we identified these groups are very vulnerable, and therefore we extended specialized support to them through UNICEF technical assistance, and this was highly acknowledged by the government and partners. But the biggest, I think, gap is again mental health related support. There are no or very limited professionals available, and then in the times of pandemic, I think we are all going through some issues around mental health, and not necessarily able to pay attention to others who require some support. And usually support is considered more in terms of material support, cash and others, but services around mental health are a bit absent. So another key area that UNICEF is still kind of focusing is, again, as I mentioned, advocacy, very high level advocacy of the repatriation of remaining number of women and children. And actually, I must say that even that latest repatriation happened in December, it was happened thanks to our advocacy and the fact that we brought all the key data to the attention of the government officials at the highest level. So I stop maybe here, not to take too much time. Thank you.
Thank you, Mr. Mahmadzadeh. That was really a fascinating response. It gives us a lot of a very precise understanding of how international organizations can contribute to the effort of repatriation and reintegration. Mr. Azizi, to follow up on that, so Tajikistan has been repatriating citizens for the last few years and has been reintegrating. You rightfully pointed out 2 issues of stigma. What is the contribution from NGOs and international organizations to this effort in Tajikistan? Is it similar to the Uzbek experience, where organizations like UNICEF play a big role, or is it a more government-led affair? Mr. Azizi?
Can you hear me?
Yes, yes.
Okay. So actually, if we compare our situation with Uzbekistan, the role of NGOs and civil society is not as good as it is in a neighboring country, and the Tajik approach can be described as the how to say, pragmatic, or maybe even tough state protectionism. And but if we are talking about international organization, the key role in bringing back played UNICEF in Iraq, and so we are very thankful for them. But after the children here in Tajikistan, the access to them is pretty limited, and you know, it's not easy to have access, and it's a reality. Even for me, the representative of official think tank under the government, it's sometimes not easy to find some data or to have access. But what to say, the most support from civil society or from international organization is material support and support in training some of our workers, social workers, psychologists, etc. But only psychologists from Ministry of Education or social workers from Ministry of Labor and Social Protection do have access to them, and that's why unfortunately I cannot say that civil society or NGOs are playing a very important role here, or how to say, the role we can point on it, unfortunately.
All right, thank you, Mr. Azizi. Yeah, it's unfortunate, but it's every state has their approach, clearly. Ms. Marshall, Mr. Mahmadzadeh mentioned briefly the impact of COVID-19, that some groups are more vulnerable than others. As you said, the children are amongst them in Northeast Syria are amongst the most vulnerable. How have the Save the Children operations been affected by the COVID-19 crisis? Has it disrupted your ability to bring resources and services to these children, or have you been able to effectively work despite the pandemic?
Yes, thank you for that question. It's hard to imagine, that things could get worse in an environment like Al Hol or Roach Camp, and then the COVID-19 pandemic, takes hold. And so it's quite staggering to think about what that has meant for children and families. We've done surveys where, the fear of catching COVID, the fear of death or losing loved ones is just compounding kind of existing fears, and caregivers already feeling like they can't provide for and protect for their children are now facing the added, stressors and fears of COVID-19. So in that environment of intensified anxiety, we've also had to rapidly adjust to COVID-19 mitigation measures. Of course, that is an environment with poor sanitation, hygiene. That's just kind of a ripe environment for the spread of COVID-19. So we acted very quickly in coordination with camp administration, who, of course, themselves was thinking a lot about this. We have close engagement with camp administration. So what kind of mitigation measures were we able to take? I mean, some of it was imposed on us. There were curfews, group activities were shut down for extended periods of time with children. So our teams were then able to adapt. We did more tent to tent kind of outreach. We were able to do kind of a reprioritization of our child protection case management cases. So look at options where we could engage face-to-face with all precautions, of course, social distancing, masks, hand sanitizer, and that with the highest risk cases. For the lower risk cases, looking at engaging community leaders, child protection committees, others in the community who we've trained and engaged with to provide that also support, because we know that our own staff and staff care and staff well-being, who are already working in these extraordinarily difficult conditions without COVID, we needed to put their care first, and also recognizing staff coming in and out of the camp creates additional risks. So it certainly was a complex operating challenge for us to face, but as we do, and as we know is so essential, the vulnerabilities and what these children face, really pushed us to get creative. We were looking at radio programming. We've been able to do some of that. We've had psychosocial support at home, activity cards that we've distributed. We've been able to reduce group sizes once kind of there was some stabilization, and we were able to advocate for some changes to the mitigation situation or the restrictions in the camp, just recognizing, balancing the risks, as all of us have been doing around the world. So small group activities, whether that was outside with higher levels of hygiene and cleaning, introducing, more wash support. So we've been very creative and proactive, but it has certainly challenged us in new ways and just further emphasized, the unacceptability of camps like this. Bad in the best of circumstances, egregious and dangerous in situations like COVID-19, where we're just so limited to respond. So I actually think, while repatriations have slowed down, the fact that they haven't stopped is a sign of that continued kind of recognition, and as Munir was mentioning, like the governments recognize now really is the time to continue that repatriation. So we've not relented, and we've continued to shine the light on that. Thanks.
Well, we're really glad to hear that, and thank you for your work in the region. That is really important. And yes, as you mentioned, governments are starting to become more aware and are starting to bring back people. And we have a question for Mr. Mahmadzadeh about that. So the Uzbek process required to repatriate required the Syrian offices on the ground, required a lot of coordination with the Syrian government and with people there. So how does would the government of Uzbekistan be open to sharing their experience of negotiations and of coordination with their counterparts in Syria? Would they be open to sharing their experiences more publicly or more directly with other states so that these states can engage in similar forms of negotiation and ultimately have a more successful repatriation process?
Thank you for the question. As I mentioned earlier, first two campaigns were documented by UNICEF, but they were more focusing in terms of the reintegration process rather than repatriation itself. On the repatriation side, I know that experience with repatriating children from Iraq was shared in a number of occasions by the Uzbek government. When it comes to Syrian caseload, there were also our colleagues from neighboring countries approaching UNICEF Uzbekistan with a similar question. But actually, we encouraged our colleagues to request governments of the neighboring countries to approach bilaterally, because there is a lot of sensitivity in terms of how things are handled in Syria, also because we know that there are local, let's say, camp authorities that don't necessarily directly cooperate with the Syrian recognized authorities, so which complicates it further. There are also some other options that some countries approach this camp through different member states and rely on their kind of facilitation. From my conversation with the government of Uzbekistan and Minister of Foreign Affairs, I think they're open to share their experience, but not publicly, more at the bilateral level, depending on the country asking for support. But I assume that in most of the cases, they will be open to share details with the neighboring countries, especially. But at the same time, our regional office for Europe and Central Asia is launching kind of establishing platform for regular exchanges among national human rights institutions from the Central Asia, and this will be a platform where actually those institutions like child rights ombudspersons or human rights ombudspersons would be able to share more and some details of how successful repatriation and reintegration processes can be organized. So again, we can facilitate, we can approach government with such requests, but I think, again, getting direct requests through embassies in Tashkent or through government to government counterparts would make it more easier. And I know, for example, again, when I used to work in Kyrgyzstan, and when there was a session held in Bishkek bringing Central Asian countries in, there were some closed door meetings, especially among agencies, and Kyrgyzstan, since they were interested to actually launch repatriation of children from Iraq, they brought their security officials to talk to the delegation from Uzbekistan to learn more on how the process was managed. So I think interaction is already happening, and then I would encourage all countries that are interested in Uzbekistan experience to approach state authorities. We would be happy to facilitate as much as we can to establish these linkages, but again, important that it is done bilaterally.
Thank you very much, Mr. Mahmadzadeh. And to follow up with you, Mr. Azizi, so a similar question, which would be, first of all, would the Tajik government be open to sharing its experience? Would it have to be a similar context like the Uzbek government, bilateral, probably direct request in line with embassies? And the second question that we have is an interesting one. Due to the fact that Tajikistan doesn't have the same degree of involvement of international organizations and NGOs, and as Mr. Mahmadzadeh pointed out, the important role that the UNICEF provides in processing identification, in basically helping the government recognize, okay, these are actually Uzbek citizens. How do Tajik officials do that on the ground if they don't use international organizations to the same extent?
So the first is the issue is in Tajikistan, comparing with other countries, is very securized. So it's the issue of top security. So as I mentioned before, it is not easy to find access to data even for us. But on the level of our Ministry of Foreign Affairs, I know that they are pretty open to share their experience. But if we want to know about our experience about the rehabilitation issues, it will be not as easy, I think, because all reports are closed. Even all reports here in Tajikistan are closed, and even if we need, I have a special request each time. So that's why I'm not sure about if it will be possible to have the data or to know about our experience about rehabilitation processes. But about repatriation, it will be more easy, I think, because the position of our Ministry of Foreign Affairs is pretty open. And about international organization, yes, as our Ministry of Foreign Affairs mentioned, they are working in cooperation with different organizations and UNICEF and others on the ground. But it will be better to ask them to know better, because I am not representative of Ministry of Foreign Affairs, so it's actually not a question for me.
All right, well, that's fair enough. Mr. Mahmadzadeh, I believe that you want to contribute to the conversation.
Yeah, very, very quickly, just to acknowledge that what we observe in Tajikistan is pretty the way it is handled in other countries. So it is considered as kind of special caseload and quite confidential. But again, we as UNICEF are there to serve our member states, and therefore UNICEF, in case of Uzbekistan, and I believe other countries also, has been seen as a partner of choice that can be entrusted to have access to all this information. Like I was personally also having access to visit recently repatriated women and children, to talk to them even. We recognize the confidentiality and sensitivity of the subject, and therefore we also consider it strictly confidential and only kind of share certain level of information that we agree with the government. So this is important to highlight, that UNICEF is not in the context of Uzbekistan necessarily seen as an external actor to that.
Well, thank you very much for that contribution, Mr. Mahmadzadeh. Yes, when discussing this concept of trust, it's pretty nebulous, but to bring you back into the conversation, Ms. Marshall, you spoke about specifically that you were able to gain acceptance for your education, for your different processes in the camps by building trust with the detainees. And we were wondering, how exactly do you build trust? How do you gain trust with these individuals that have been through these experiences and that might be weary about cooperating with Westerners or with an international organization like yours?
Thanks. That's a really important question and something that we think very deeply about. It starts with humility and a commitment to understanding the people that we are working with. And the way we orient it is around children. So before we view them through various lenses as, radicalized people, as ISIS members, they're also mothers, their sisters, their daughters, and we're asking and engaging with them about what do you want for your children? We're looking at their children in front of them who need nutritious food, who need a safe place to play, who need medical care. And and that's where we focus, and that's the level at which we engage. And that's the point for us. We are there as an independent humanitarian actor to address humanitarian needs, and we follow the humanitarian principles very closely. And so when the starting point is care for children, I think that strips away a lot of the other challenges. And at the same time, it requires dialogue, and it requires kind of showing what our approaches and interventions can actually offer and benefit to the children. So whilst there may be skepticism around, social and emotional learning, when we offer some programs and caregivers start to see how their children's behavior is shifting away from sort of the intense aggressiveness or withdrawal that they've been displaying and start to demonstrate some more positive social skills, are able to communicate a little bit better, I mean, parents themselves then see the value that it is offering to their children. And in that, I think we further kind of build their trust and their buy-in. But it is a step-by-step process, and it requires training staff and having staff who are highly sensitive and in tune and excellent communicators. It requires regular feedback and acting on feedback that we receive. So it is very much at the core of our programming. And I think it has interesting linkages also to what our colleague Rustam was speaking about, is the engagement with communities. So community level child protection, community level action there's a very, it's always been something that people in this space have been thinking about, but there's increasing sort of acknowledgement and attention around what does community level child protection require? How can we be more building on existing protective structures and individuals who are individuals and groups who have children's best interest in mind. And so I think there's learning both for us inside Syria on the ground, but also in these settings where we need community buy-in to be able to safely and without stigma repatriate and provide a safe future for these children. Over.
Well, thank you for that answer. And that is really fascinating and a really important thing, a really important experience that many organizations and governments could learn from. I just wanted to follow up with you with a quick question, a situation, perhaps not a quick question, not an easy question, but the context that we haven't discussed when it comes to Northeast Syria is that Syria is in a deep economic crisis. And the question we received was about how do your camps provide PPE and wash services? How are these specific physical assets, how are they brought to the camps, and how are they procured in the difficult Syrian context?
Yeah, that is a good question, and one that certainly my colleagues in water, sanitation, and health, so WASH colleagues and other sectors have been fully preoccupied with. I mean, there are supply chains for accessing PPE, there's water trucking, we have WASH teams who are able to install various sort of water and sanitation setups within the camps. I mean, this is always done in collaboration with camp administration. There are chronic water shortages actually in Northeast Syria that affect the wider population, not to mention the camp itself. So it is an ongoing struggle and challenge. But I can say that, from our small perspective, this is a kind of collective action, we've also advocated with donors to be able to shift around budget lines, to be able to procure more PPE. We have set, very clear interagency minimum standards in terms of hygiene and sanitation so that we can safely continue activities. So it's been sort of a real-time revision of our approaches, or sort of an upgrade to our approaches. And there are, with limitations, with challenges, and through various negotiations, we have been able to meet those necessary standards for health and safety. But it is something that we are constantly working on and engaging with partners.
Yeah, I can imagine it's a challenge, and having to restructure donor payments due to the COVID crisis has to be very difficult. When we're focusing on the rehabilitation and reintegration, let's move on to Mr. Mahmadzadeh again. So let's return to this question of resources. How do we ensure that the government stays focused on this issue on the longer term? Because rehabilitation and reintegration, it isn't a single process that takes one day. How do you ensure the government stays focused on this issue? And how do you ensure you have the resources necessary to adequately provide the services to these people in need?
Thanks a lot. Thank you for the question. I think what is critical here, as I mentioned, to the establishment of this interagency kind of coordination platform, we have managed to bring attention of the high-level officials to this. In Uzbekistan, it is actually coordinated at the level of Deputy Prime Minister in charge of the social sectors, and this is how we were able to bring relevant institutions on board and actually get them budget certain expenses in this field. But of course, as UNICEF, as I mentioned, since there are some gaps in terms of provision of services, especially new types of services like social work, social support, we continue investing UNICEF's core resources, but also some of the resources from other development partners. We're about to receive financial investment from the European Union and some other partner organizations from the other development partners and countries. So we continue investing in social workers as the primary interlocutors with returning families, and streamlining communication through these social workers and ensure that they're provided with all adequate resources, including regular training, and so that they can connect to relevant services and refer those families to different service providers. And some of them anyway provided in large, free of charge, at least some basic medical services extended to all local populations, and same for education is compulsory and free. So, but this accompanying support that we are providing still requires some donor investment and partners investment, and this is how we right now continue our support. And we hope that increasingly, since in the parallel, we're helping government to build the child protection system in the country and social protection system, we will get all these services in the long run available for all range of issues and cases associated with vulnerabilities, and hopefully in years to come, this particular group wouldn't require additional support, but if they would, then they will basically benefit from the integrated service provision, which hopefully will be available as statutory services at the local community level.
That's very interesting, and as you said accurately, I mean, if reintegration is successful, they will not require these additional services. I wanted to give the speakers an opportunity to provide a final comment or insight to our participants, a final word for them to be aware of and to take away from this conversation. I'll start with you, Ms. Marshall. Ms. Marshall, is there anything you would like to say to the audience today, to people listening, something that they should take away from this discussion?
Thanks very much, and thanks to all for really thoughtful questions and an interesting conversation. I think what I would just encourage everybody to do is to continue to bring the narrative around what these children have experienced, the denial of their rights, that really children are the greatest victims of what has happened in Syria, and that we can work together to provide a more hopeful and healthy future for them. So it's a narrative around, you know, what are we doing for the most vulnerable among us, and what really can we do, drawing from examples of really repatriations being possible and being able to change the trajectory of these children. A resource that I'll be sharing after this, and Cooper, I'll appreciate your help, is we've just released a really neat graphic publication that illuminates some stories from children, because of course, we protect their identities. We're very, very mindful of confidentiality. So we've created this unique and very engaging you know, advocacy discussion piece. And so we hope you will use this. I'll also share the link to our video. We just want to make the situation as sort of real and tangible for people, so it spurs them to take action and move children into a more positive direction through our collective action. So thank you very much for giving us this chance, and we look forward to continuing being together in this effort. Thanks very much.
Thank you, Ms. Marshall, and thank you for joining us today. Your insights have been really helpful in helping us understand the issue, and we'll be delighted to help you with the advocacy efforts. Mr. Mamadzadeh, for you, any final comments that you'd like to leave for the audience today? Anything that they should take away from this discussion?
I think just to reiterate once again, this is what Ms. Marshall has mentioned, and also I mentioned in my statement, that we should consider children, first of all, as children, not the ones associated with someone, or as we would usually treat any children in vulnerable situations that require special protection measures. This group has to be considered as one of them and treated again, first of all, by applying best interest principle in each and every individual case. And I think while repatriation and integration work has been kind of led by the government, it's important to have government full ownership, but also I think we need to see what is the workforce available on the ground to support this initiative, because again, political will repatriation might be a success, but then if we end up repatriating children from one vulnerable situation and then maybe not always have ability to fulfill their rights after repatriation, it's also another concern that we might need to pay attention. But again, in each and every individual case, we don't exclude the fact that in some, I don't know, very limited number of cases, for example, institutionalization can be an option of last resort. But the key principle is that we try as much as possible to reintegrate children to their communities and look into family-based care. And I'm sure this is something that is being discussed in Tajikistan or elsewhere, and UNICEF, along with other partners, will be always happy to extend its technical support in that process. Thank you very much. And thanks a lot for this interesting exchange and conversation.
Thank you very much, Mr. Mamadzadeh. And yes, the dialogue hopefully has helped people understand more deeply the issue and will make them more able to contribute to its solution. Mr. Azizi, let's check in with you. Are the technical difficulties
Can you hear me now?
Yeah, yes, we can hear you now. Can you hear us?
Oh, thank you. The situation with children from Iraq is a little bit different from those who are in Syria, because their mothers are in prison. So it is the first issue. But some of returnees, for example, those who were from Afghanistan, they are with their families and their beloved ones. And you know, one social worker at the Ministry of Education stated that not all repatriated relatives, and some relatives don't want to, that they fear that these children may have negative effect to their own children, the first one, and also they don't want to attract an attention of law enforcement agencies and social services. It's also an issue. And also Ombudsman for the Rights of Child said that not all children will be handed over to their loved ones, even after rehabilitation. He examined first, and the best environment for raising children is family, and no one agreed that. But some families are problem, and they said that some families, even now, they don't have proper condition, and some of them still now follow some radical ideas, etc. But it's a really interesting issue, but it doesn't mean that all children will be in orphanages, or if there is a possibility, some children will be back to their families, but I'm not sure that all of them.
All right, well, that's all.
And
yes.
And at the end, I would like to thank all organizers for organizing such kind of meeting, and it was really very useful for us to share our experience, to ask some questions, and to know different approaches. And once again, thank you all for inviting me and for your participation.
Thank you, Mr. Azizi, and hopefully you can solve your technical difficulties out there in Dushanbe. That concludes our panel and our question and answer session. I would like to thank Ms. Marshall, Mr. Mahmadzadeh, and Mr. Azizi for all of their professional insights today, and for having taken the time to join us for our discussion. Your perspectives were really appreciated and helped us understand the intricacies involved when it comes to the situation of children trapped in northeast Syria. I would like to thank all of our participants today for taking the time and for engaging with our experts. We will be hosting more of these dialogues in the future, so stay tuned to the Bulan Institute. If you like this dialogue, please inform your friends and partners, and don't hesitate to reach out to us. In the meantime, I wish you all a wonderful day, wherever you may be, and look forward to hosting events with you in the future.